We have a question from Hema from UK. She's saying how to shield yourself with prayers or symbols before we start a treatment to others. Which side client head to face towards to ourselves?
Second question was not very clear. Probably the voice broke in between when you were speaking.
Ah, okay. So the second question, I think the wording is not clear. Which side probably the client should face, head to face towards us,
All right.
to or himself?
Okay.
It's just worded.
The question of Hemaji is very nice. The first part of the question is very important for us because I never discussed about that thing. She says, how do we protect ourselves? How do we create a protective environment? How do we have a shield around us? So there are, if we are this, we are, okay, this is what we are. So this finger is representing you and you are in an environment. And this is the environment in which the finger is. So this environment is divided into the upper direction, the lower direction, the right direction, the left direction, and then the sides. So there are directions. So what we do in all the major 8 directions, east, west, north, south, then the northwest, the southwest, the southeast, the northeast, we draw a chokyu ray. So if there is any negativity, let it bring it out. If there is any negativity, let it bring out. If there is any negativity, let it bring out. If there is any negativity, let it bring out. Let this environment be free from negativity. Then we do a siheki. We balance out. We balance out. Because in the environment, there will always be a disbalance. Where I am living in now, the humidity is more because it is rainy season. Now the photographers know this. If you have a, all of you have a phone, you have a home, you click your photograph at the noon time at 12 o'clock, wherever you are, and you click at 4 o'clock, and you click it during the summers and you click during the winters of the same person sitting at the same place, you'll find there is a lot of difference in color. When it will be winters, the photo would have a bluish tinge. When it will be summers, the photograph will have an orangish tint. To a person who can read the colors, he has a sensitive eye. To an artist, it is easily decipherable what kind of an environment I am in. For healing, if something is extra, it is not good, even if the light is extra. So for example, right now I am seeing you, all of you, then I can see that there is one Miss Susan Grimshaw. A lot of light is coming from the background. So this is extra heat. So probably if London, what is the time in London now? Nisha ji?
It is
Approximately.
about 6, 7 o'clock evening.
In the evening.
4 to 7.
4 to 7. 6:45. So,
if it is 6:45 over there and Susan is from the UK, then she is where she is sitting, south is behind her. Sorry, west is behind her because the sun sets in the west. So west is behind her, east is in front of her, and there is a lot of orangish tinge happening. So as healers, the first thing which I'll do is I'll close the curtains at this particular point in time. Because at this time, but if it had been 10 o'clock in the morning, 10 o'clock in the morning, doesn't matter because the sun is not going to be where it is right now for her, right? Because the sun is going to be in the east. Her window is in the west. Now, if you know about all this, then you can see what kind of an energy is prevailing. To a person, for example, Susan is trying to treat the lady, our participant, who had just asked the question regarding numbness. So for a numbness patient, for a coldness patient, heat is welcome. That is why I told her to take a sun bath. Now, if Susan is treating her, then she will not close the curtain. But now this is so difficult for a new person or a novice to do, to analyze. For us, it is a second nature because we think in terms only of energy. I think only in terms of energy, whether it is astrology or whether it is healing. For me, it is all energy. Now, for you as a beginner, what should you do? Make everything neutral. So if there is a lot of heat coming, close the curtains. If there is a lot of coolness, if the environment is very cold, I told you to warm up the room before your person comes in. If it is a lot of hot, warm up the AC. Let it be neutral, because you don't decide. You can't keep on changing the settings of the room from one patient to the other patient. So what do? We make sure that the room is neutral. Everything is neutral. It is just like, when you prepare a person for an interview, the person would ask, okay, what should I wear? Should I wear a green shirt or a red shirt? So we say, no, don't wear any color, wear white, because it is neutral. But if you know that the interviewer prefers a green color, then wear a green color. In the second interview, the person, she's a lady and she likes a pink color, so you wear a pink colored shirt if you want to get selected. But if you do not know, and you can't change between one interview to the other interview, wear a neutral shirt and alter your answers to suit the interviewer. Similarly, take a neutral room and then draw chokure and seheki, and then again a chokure in all the 8 directions. Once you have done it, then your environment is safe to start the healing process on your patients. Secondly, she asks, where should probably the face of the client be while you are treating him or her? In a standard procedure, I have demonstrated to you via a separate video that you are standing near the crown chakra and the patient is lying down, and slowly and gradually, either from the right side or from the left side, you will move on to him or her and try to heal. However, after a little while, you will know that if a person has come and the problem is only in the adrenal glands, then you can go straight away and work on the adrenal glands. In this particular process, the patient might be facing east or west or north or south. It won't really matter. Now, directions do matter. It doesn't mean that directions don't matter. Sometimes when I am treating a person, and normally a person would get healed, but this person is not getting healed, then I ask him, in which direction do you generally sit in the house? For example, it is a rainy season. There is the direction for humidity. If he is sitting, and it changes from place to place, like from in the northern hemisphere and in the southern hemisphere, the north and south, they change. So let us not go that deep into it, because that doesn't form part of Reiki. But all I'm trying to say that if I am telling you to ignore the direction, that does not mean that the direction has no role to play. It is a separate subject altogether, direction therapy. Because all the energies which are coming to us, they have a direction. And for example, the south direction, should I give you an example, or would it be digressing from our topic? Should I give you an example, or should we move on, because it does
not... please. Example will be good, please.
An example, okay. So, for example, in the northern hemisphere, where most of us are from, the UK, the US, India, the south is the heat region. If a person is suffering from a lot of heat in the body, and you are trying to solve him, and again the thing reoccurs. Or a person is meeting accidents again and again and again and again. Or a person is has boils again and again and again and again, boils. So, acne, what to do? You ask him, do you, in your office or at your home, do you spend a lot of time in the south direction? And when I say the south direction, it is not looking towards the south, it is being in the south direction. If he is, just ask him, can for 15-20 days, can you change your direction? Can you change the place where you sit? Is that possible for you? And then you will notice that once he moves and he changes the direction, then things start to work out, his problems start to heal. That is called direction therapy. So for every direction also is an energy. And if you realize that, then you can use that in your practice as well. But for Reiki purpose, we don't need it. We are comfortable, even without it. Yes, ma'am. Nisha ji. So anybody else, any question left?
Yes, I have one more, but I think Gargi ji has some question. She has just messaged. I can't see the message. Can you, Guruji, or if you can unmute Gargi ji?
I can ask to unmute. Yeah, okay, I have. Yeah.
I think it needs to.
Thank you, Nisha.
Good.
Yeah. In fact, I think most of the questions have been asked from you. I got few questions, but I think most of the questions are done. So thank you very much. I think in the beginning you told something about me.
Yes.
But sorry, I couldn't join at time. I have some audio problem with me also, with my, I don't know, with the connectivity problem. So my heartfelt gratitude to Guruji for sharing, for your unmatchable knowledge about the subject and putting in so much of efforts and presenting everything, in different forms like videos, clips, taking all the questions and answers and live demos. So that represents, your unmatchable knowledge about the subject. So thank you so much for giving us such a valuable time. And thank you so much. Earlier couldn't join the question and answers before, but I hope this is the last session for question answers, or still it's going on. Guruji will tell. So really thank you all the participants who joined, and I hope you all are so much benefited by this course, and I know you all are going to apply in your lives, and it's really going to help all of you. So thank you, Nisha, for conducting this program so nicely, successfully, and congratulations to all of you for the successful completion of this course. I congratulate each and everyone for this. Thank you. Thank you so much.
Bless you, Guruji. Gargi ji.
Nisha ji?
Yes.
Sorry, Nisha ji, I'm
of us.
Shalini. I sent you some questions to ask.
Yes, you are next. You are next.
Okay, thank you.
Gargi ji, thank you so much, and namaste.
Thank you.
Thank you for all your support. Thank you for your support too.
Thank you. So yeah, please you carry on. I have to leave. Okay. Bye-bye.
Thank you. Bye-bye.
Thank you.
Bye.
Okay. Okay, Guruji.
Ji, yeah, please.
Yes, there's a question here from, apparently it's anonymous, but Shalini came over just a minute ago. Where the healing should be provided for diabetes is question 1.
Okay, so it is in the pancreas. So either the pancreas has 2 functions. I'll just draw and show you. So if this is the pancreas, okay, it starts from here and ends here, near towards the spleen, but does not touch the spleen. So there are a few glands here and there are a few glands here. Now pancreas has two functions. A is it secretes digestive juices. So if a person is having problems as far as digestion is concerned, then this is the area we provide healing to. And in this diabetes, the problem is in the production of insulin, glucose, etc. So the problem is here. So this part of pancreas you have to provide healing in. Otherwise, you have the stomach meridian, you have the spleen meridian, and you have the Manipur chakra. This is for diabetes, ma'am.
Thank you, Guruji. Question 2. If you have not done any Reiki since being attuned, would the attunement still be valid?
Sorry, can you come again?
If one has not done any Reiki since being attuned, would the attunement still be valid?
It is always nice to get yourself attuned again. If it has been a lot of time since you were attuned and you did not, you fell out of practice, it is far better just go and have attunement done. What is the harm in that?
Sorry, just interrupting. It's me because I was attuned by yourself on that Monday, but I have not been able to do any Reiki since then. So would that attunement still be valid?
Yes, it would be valid. It was just recently that we did the attunement. It has not been many years since then. So that is why it is not a problem at all. Even if after 1 month you start to do Reiki, it will still be valid. However, if 1 or 2 years elapse and you have not practiced Reiki at all, then perhaps it makes more sense to get yourself attuned again from a Reiki master who lives somewhere nearby.
Okay. Thank you. I'll probably do it, when the kids go back to school. So probably in September.
Yeah, this thing will work by September as well.
Okay. Thank you. Thanks.
Most welcome, ma'am.
Okay, so Guruji, question 3. Where the healing should be provided for anxiety and depression?
Anxiety, we have taken. Depression also we have done. But
yes, we
you
have.
are asking again, so a smaller, just to give you a small answer. Depression is dryness energy. We go to the Swadhisthana chakra, or we go to the lung and the large intestine meridian. And for one was depression, and the other thing was anxiety. For anxiety, anxiety is something which is very sticky. Okay. So for anxiety, we'll go to the Mooladhara chakra again, and the stomach and the spleen meridian.
Thank you, Guruji. Okay, so I have a question. Can you provide healing to your children if they have anger issues or if they are slow learners? Can you provide healing to your children if they have anger issues or if they are slow learners?
Yeah. I was just thinking for a little while before answering.
Sorry.
So yes, and not only yes, but a very strong yes. I mean, you can make a significant difference when it comes especially to learning disabilities or making sure that the learning becomes faster. Reiki helps immensely, even in autism and various kind of learning difficulties. But the question is, you should know where to provide healing for that. So since this is a developmental issue, we go in for the hotness energy or the heat energy, and therefore we'll go into the brain meridian and that means the pericardium and the triple warmer meridian. And we go to the Agya chakra for developmental issues. And as far as anger is concerned, anger is wind energy, and therefore we go to the liver meridian. And now the question is, how is the anger? How does it expresses itself? When the person becomes angry, does he starts to throw things off and break them? Or is it a internalized anger? Some people start to beat themselves, some people start to beat others. So there is a lot of variety in anger, but generally speaking, go to the Anahat Chakra and provide healing over there, and anger would be somehow reduced. The frequency would be reduced, the intensity would be reduced. You do it from the front and you do it from the back as well, from both the sides, from the front as well as the back in the Anahat Chakra.
Thank you, Guruji.
Guruji,
Ji, Mita ji.
just I want to ask one thing, that I am practicing Reiki from the day first you attuned. I have some more energy problems with my hands. The hands are, specifically the fingers are very much heavy and paining. What should I do?
Are they paining after you're doing Reiki, or they were paining even before you were doing Reiki?
After Reiki only. After Reiki, for 2 or 3 days is all. It is ज़्यादा हो गया.
आपके वहां पे बारिश हुई है? Did it rain?
Yeah.
In the rainy season, do you have an increase in this kind of a problem?
No, never. I never had this problem.
Okay. Are you also feeling heaviness in the head or in the body? General level of tiredness has increased.
No, not like that. Only
Okay.
this 3 fingers only paining.
So A is take a break from Reiki for 1 or 2 days, and B, from the other hand, heal these 3 fingers by making chokure maximum number of times, or draw a chokure and keep it on the fingers.
Okay.
Draw a chokure and keep it on the fingers.
Yeah.
Other thing which you can do is write on a sheet of paper, let my fingers be okay very soon, and then draw a chokure on it.
Okay. Thank you.
That is also doable.
Okay.
We have done experiments with that. Ji, ma'am.
Okay, thank you.
Namaste, Guruji.
Namaste, Ji.
This is Prasad. Thanks for the attunement. I've got a couple of questions. So I have learned pranic healing in the past, like I have got some levels of pranic healing. So my question is that can we mix these two, like in the sense that in some techniques in pranic healing, like, general sweeping or those kind of things are kind of quite easy, and the symbols that you have provided are quite interesting. So is it any way, can we club some of them from both the approaches and give the healing to the give healing to others?
There are 2 kinds of people in the world. A are leaders and B are followers. For being a leader, you have to put a lot of hard work. You have to make a lot of sacrifices. And for being a follower, you just have to spend some money. What I'm trying to say is that pranic healing is an excellent modality and Reiki is an excellent modality as well, and both of them can be perfectly combined to heal our patients, because both of them rely on the pranic force or the ki, which is available everywhere around us in abundance. The question is, how to exactly do it? The answer is, either you find it for yourself or you take training under a guru. Now, if you go to a guru, he would have sacrificed a lot many years finding out how they both will complement each other. So you just have to pay. Otherwise, you put in the effort, take some guinea pigs, because in any case, it is not going to have any kind of a negative side effect. It is only a question of how faster the healing can be. And then you see how both of them can merge together. But yes, they complement very well each other.
Yeah, thank you, Guruji. My second question is that For example, if some our older parents or elder people are going in flight and they got some fear in, or maybe like, they're afraid of going alone in the flights and all. So how can we use these symbols, or maybe can we give these symbols in any form to them in a paper or something, so that they'll be safer or something?
Yes. You have to work on two levels. So the first thing you have to do is, for any fear, we have to go to the Muladhara chakra and providing healing to the Muladhara chakra. But when? The answer is when they have to fly. Before that. So you are doing it today and they are having a flight 3 months later. It is of no use. So we have to use our common sense, because these things are not written in the books. The simple fact is, tomorrow your parents are catching a flight. They are having a very anxious time. You provide healing today. Number two, let them write on a piece of paper that I am going to have a beautiful, wonderful, hassle-free, healthful, and nice flight, and then draw a chokure and then keep it in their pockets on the left pocket. And the seheki, because what is the most important symbol in this case? It is seheki. Why? Fear is a very important force. If you have no fear, then you are a madman. You will do whatever that comes to your mind. And if you go untamed, if anybody of us, I'm sorry if I have been a little rude, but the point is, what I'm trying to make is, all of us have instincts. So the instincts need a leash, okay? Like a dog needs a leash. Now I'm doing it on myself so that you don't feel offended. So you need your instincts, they need a leash. And the leash is of fear, of the repercussions which your instincts might entail if they happen in reality. So it is very important to have fear. But in this case, fear has increased to disproportionate levels. That means there is an imbalance. And whenever there is an imbalance, what do? We do seheki. See, the good thing with you is you have very less syllabus. You only have 4 symbols. If you would have 120 symbols, it would have been difficult. For you, it is there are only 4 choices to make. Which is the choice which goes for harmonization? It is the seheki. So you do the seheki symbol on their Muladhara chakra, and then make them write this on a piece of paper, draw the chokure and the seheki, and they will have a safe flight.
Yeah, thank you so much, Guruji. Yeah, much appreciated.
Guruji, can I ask a question? Guruji?
Ji, please go ahead.
Yes, I'm Shobha, talking from Surat. I have a severe indigestion problem. Even just now, I'm having acidity when I'm talking to you also. And since long, I'm doing some medication and all that, but I'm not solving it. So what should I do for that?
The food comes above? Sometimes?
Yeah, both the ways. I feel acidic in the stomach and the above one also.
Muladhara chakra needs healing. There's a lot of acid, so you need to have something which is cooler. So you need to increase the coldness in the stomach. So on the stomach meridian, increase the coldness by putting blue color. Or this, what is called balancing with the seheki. One energy is more. What energy is more in the stomach meridian? Heat has increased. It is causing acidity. Okay. The other thing is, if you are facing an increase temporarily and there might be a rainy season, so humidity might have increased. So to solve humidity, what would you need? To solve humidity, you need wind. So put the green color. But in both the cases, the symbol which we'll use is the seheki symbol. And the chakra which you will use is the Manipur chakra.
Manipur chakra. Okay. Thank you, Guruji. And one more question. Yeah. One more question. My children are out of country, and if I want to send them the Reiki, can I send them? But I can't tell them that I'm telling, I'm sending, because they won't believe or they won't have this and that. So can I send to them? They have some problem?
They already have Reiki. Everybody has oxygen. What do you want to do? You tell me that I want to send them Reiki. They already have Reiki. Everybody has. What do you want to achieve? Are they suffering from some problem which you want to solve?
Yes, yes.
So then tell what the problem is.
Yes, they are, because of this COVID, they have some problems in their jobs and all that. So they are very depressed and all that. So I want to just give him a support thing like that. He will be okay, and he's depressed and his anxiety is there because he's far from the parents and all that also.
Yeah, so as far as what to do is concerned, that was clear in the previous question regarding anxiety and depression. Now let us consider this moral dilemma, whether we should give to someone whom we don't know. No, we should not, until it's a life and death situation. But this is not someone you don't know. It is about your children.
Yeah.
And probably, you know, there are two thoughts on it. More number of lives. Now, these are all normative statements, what should be and what should not be. And since they are philosophical constructs, therefore my view might be different from your view, and we both of us might be right in our own ways. So this is something which you'll have to take a call on. And probably you might change from one situation to the other situation as well.
They don't believe in this thing, so they say, oh, what your Reiki and all, you know, like that. So I feel that if they don't believe, shall I give? That is the thing.
Ma'am, nobody believes. Nobody believes unless you do something for them. And once I do something for other people, then they don't leave me. And that is why till today, I have never ever advertised. I never found any reason to advertise. My people are already surrounding me, so I don't need an advertisement. But what kind of cases I receive, you know, where doctors say no, then people come to me. Last month, I had a case from America. They had done everything to diagnose what this a little girl of 17 years is suffering from. Every year she'll try to kill herself. And will be a strong pain in the stomach. They did MRIs. They did whatever it was humanly possible to do in America. That means the medical facilities in America are nice. It is not, then which is the country where medical facilities are nice, if not in the US? And he was a very well-off guy living in California, because in California there are a lot of IT people, and he was an IT people. He had his own company. So he told me that, sir, money is no problem. Can you help me? Somebody has referred from California, and this is the position. We have gone through every kind of medical examination which possibly there can be, but we are not able to diagnose, and it is a question of life and death. Just day before yesterday, my child has again tried to take her life. So therefore, I need some intervention at some level. Now, this is the kind of cases which come to us, because where doctors say no, then the person says, oh, what can be done? Let us try Reiki, let us try homeopathy, let us try. It is only once you have tried and you have gotten a solution that you come to me for a normal problem also. Otherwise, you get a critical problem.
Yeah.
So for a person who has devoted his life in these fields, it is very nice to get critical problems, because I feel happy when I get a critical problem rather than solving something which I have already solved. But for a beginner, it is scary. For a beginner, you need a normal problem to solve first. You need a normal headache. You don't need a 10-year-old migraine to solve.